October issue, there's going to be a specific issue just on COVID, COVID and dentistry, and this is going to be one of their featured articles, and it's on the mouth COVID connection, IL-6 levels in periodontal disease, potential role in COVID-19 related respiratory complications. And this is my co-author. She's an amazing woman in South Africa. She's also a periodontist, PhD, and it was a pleasure working with her on this paper. They made it available digitally just about a day or two ago. So this is very fresh, and only until now I've been able to actually share it. So this is the kind of the overall of how the connection is, and I'm going to be getting into each of these. But basically, there's different pathways where the mouth links to COVID and our lungs, basically, and leads to respiratory complications. So we will go over that, and we'll introduce the topic. We'll talk about IL-6 in relation to period. It's an inflammatory soluble protein. It's an inflammatory protein. So not all proteins in the body are good. There's a lot of bad proteins. C-reactive proteins, or CRP, is also a bad one. But IL-6, there's IL-1, 2, there's all these ILs. IL-6 is a very bad one, and we'll get into that. We're going to talk about respiratory diseases and periodontitis, that link. IL-6 viral infections and COVID-19. We'll talk about biological mechanisms of how this process happens. We'll talk about perio treatment in COVID-19. We'll talk about IL-6 genetic testing, and I'm going to go over some solutions and some action items and things that you could tell your patients to do to make this things better. So basically, the clinical importance of my review article lies in the awareness that dental professionals can have a major impact on the COVID-19 pandemic through promotion of periodontal health, considering the benefits of prevention and treatment of periodontal disease on overall health, including prevention of complications resulting from the coronavirus disease. So this COVID, let's start kind of backwards. What's happening with patients? What are we seeing? Well, basically 80% of people who get it don't have symptoms, really. They're very mild cold symptoms, perhaps. No major complications. 20% get severe symptoms, like respiratory problems. And of those 20%, 5% of them are life-threatening, like require intensive care unit or ventilation, intubation, and having a machine breathe for the patient. And what leads to this downward spiral has been linked to IL-6. This is when you hear about the cytokine storm. IL-6 is a cytokine. This is what's storming. This is what's going kind of elevating and getting out of control. And there is a study that showed that we're going to talk about. So how does COVID relate to dentistry? Well, dental professionals have suffered the impact of COVID-19 in profound ways, which is directly related to the importance of the oral cavity as a transmission route. So the potential for salivary glands to function as reservoirs for COVID-19, the infectivity of the saliva, and occupational health issues due to the nature of dental treatments. With the reopening of the dental practices during this pandemic, dental professionals are really faced with challenges that range from strict infection control measures to a decrease in the number of patients willing to undergo treatments. And we've all experienced this. Now, there's going to be a shift in a more general health. And this is what I'm trying to explain to everyone, that we as dentists, we're going to have to shift. And we have to look at now, not just at the teeth, we have to talk about overall health with our patients. Because infections in the mouth, gum disease, periapical radiolucencies, retained root tips, root canals gone bad, cracks. All of these contribute to systemic inflammation and release of cytokines. And by dentists focusing more on this aspect, we can become part of the solution for our patients. They will see it, they will feel it as you explain it to them, and this is how perio or the mouth connection works, basically. Not too many people are talking about this. And the people listening to this lecture, I feel, are going to really benefit. And patients are really, these days, they're not seeing their doctors too much. If they're not sick, they're staying out of their medical doctor's office, because they don't want to be in an office where maybe someone else might have a sickness. So people are not seeing their doctors as much right now. So that means there's a void. Again, I believe there's a void in healthcare, because if people aren't really talking to a doctor, then they may feel kind of lost. All they're relying on at the end of the day then is just Google, the news, and we know right now, every day something changes. Things are different. You can't really rely on the news too much. So people are staying home. They're staying kind of out of the streets more, especially the elderly. And the elderly are a huge population because of especially in the U.S., United States, we have the baby boom population. So these are also the people that have the most gum disease as well. So we have to protect this group of people. Now, the impact of the connection between periodontal treatment and IL-6 levels, respiratory conditions, and COVID can be powerful, considering the high prevalence of periodontal disease in adults, the transmission rate of SARS-CoV-2, the limited access to periodontal treatment during the pandemic, and the shortage of healthcare resources related to hospitalized COVID-19 patients that require mechanical ventilation. 47% roughly of patients in America, at least, they have some sort of mild or moderate or severe periodontitis. So not gingivitis, but periodontitis, which means it's when periodontitis is when it's happening in the bone, the problems in the bone, the infections in the bone. The more advanced form of periodontal disease. And in adults that are 65 or older, the prevalence rates increase all the way up to 70%. So this is a huge issue. And the dental groups, when you see on social media, you go on Facebook. There was one the group that I'm a part of. It's called Coronavirus and Dentistry. Someone asked the question, are you guys seeing a shortage of hygienists in your state? And literally everyone was like, yes, in my state too, hygienists have been a little bit scared away by the media and everyone that, they have their own Facebook groups. They're talking, we don't have enough PPE, we need more time between patients. I need a Cavatron and I can't use it at this time, so I can't, work. So we've seen, and then also you have the part-time hygienists that were only 1 or 2 times a week. There were moms part-time, caretakers that had, maybe another job. Those people are like, well, it's not worth it for me to come back 1 or 2 days a week because of, the chance of maybe dying. So why would I? So there is a shortage of hygienists, and it's noteworthy that in at least the United States from what we've seen. So this is a chart of kind of where we're at right now as far as in the United States. So I know we have people from all over the world, but in the United States, the number of cases are rising. They are doing more testing, and this is the number of hospitalized people hospitalized. So we're seeing a we have a second wave. I know in some countries they are able to get it under control. You have Sweden, who has been of late, has brought down the numbers. We have a lot of other countries. If you want in your comments, if you have a country that's doing well, you can write it. But we have some, as such a big country with 350 million people, we are having some trouble. And for such an advanced country, this shouldn't happen. So I'm trying to do my part as much as I can to try to help with this. These are the deaths. And when you look at a graph like this, you want to look and see this line that you see. That's the 7-day average line. That's a very important line because that shows a trend. Without this line, you can't really see a trend too much. So this is as of maybe a week or so ago. We started to see some more deaths in the United States. But overall, it's not, I feel that we got this number, this peak has gone down because of the treatments have gotten better. So doctors are getting smarter, seeing what works in other countries, sharing information. There's WhatsApp groups of doctors. There's different medias, where, different avenues where doctors are communicating and collaborating to try to beat this. And it's a great thing to see the world working together right now. So let's talk about IL-6 in relation to periodontitis. Now, periodontitis, remember, is an inflammatory process. It results in the destruction of the periodontium, triggered by mediators such as the ones you see here. And again, they're soluble proteins, and they're signals. They recruit cells. They think of it like these cells, the PMN, which is neutrophils, the macrophages, the B cells, the T cells. All of these cells, endothelial cells, epithelial cells, all of these cells can release IL-6. There's very few of these cytokines that literally almost all of them are releasing IL-6 or have the ability to. So when our body gets bacteria in it, and we have these, first line of defense, you have the neutrophils, and then you have the other cells coming later. But each of these that come in, they can release IL-6 and other cytokines. And it's kind of like they're sounding the alarm. There's a war, there's like a first shot, and someone's ringing the bell and trying to get the troops ready for war and battle. So what happens? One soldier comes and hears the bell, yells it to the other person yells, the whole body. That's why it's called a cascade of a communication, a cascade. One leads to another. And it's a trigger. So IL-6 is also involved in host response to infection, injury. It also is involved with bone resorption, which we'll talk about. Now, there is different types of IL-6 or different polymorphisms, genetic polymorphisms. I don't want to get into it too much, but just know that there's different types of them depending on the nucleotide sequence. These two are the most common. You have the 174 and the 572. They're the most common. What I want you guys to know is this. Everyone has an IL-6 gene. This gene has two alleles. These alleles are either a G or a C. Now G is not good, C is good. So if you're GG, it means you're high risk. If you're GC, you're medium risk, and if you're CC, you're protected, you're at a low risk. And so I personally, I got mine tested. Once I learned this, I said, so there's a salivary test, you spit. When I got mine tested, I won't say what it was, but it wasn't a high, thank God. But if it is, if you have a high, at least then you know that how to behave and you know, are you going to be the mask wearer, you know, where you have the N95 when you're hanging outside, or you know, it's good to know what your risk is. Then you can make better decisions about your life and your survival. So that's a really important. We're going to touch on that again. Now, the IL-6, there's a high expression of IL-6 that has been reported in inflamed gingival tissue. So right in the gum, upon, you know, the bacteria in there, and it's in response to something called LPS. LPS is a polysaccharide. It's secreted by the bacteria when it comes in. It's a weapon. Think of Spider-Man has like a web. You have something going in, and they're releasing something, and that breaks down the gum and bone tissue, the LPS, and so in response to that, we have a higher IL-6. Plus, there's a role IL-6 plays on periodontal bone destruction through osteoclastogenesis. So it could break down bone, and it could stop the formation of bone as well. Okay, so literally it can do both of these things, and it also upregulates and stimulates production of something else. It's another weapon, MMP. MMP degrades collagen. So think of it like these bacteria come in. Again, these are periodontal pathogens that enter. They have weapons. One of them is LPS, one of them is MMP, and they're going in. One of them breaks down bone. One of them can go break down collagen and activate, as a result, your cells to go and release IL-6. And then this IL-6 enters into the bloodstream. So we see 4 places where IL-6 gets released. We see it in the gingival crevicular fluid. So the little fluid, it's a very small amount of fluid that's inside the sulcus of the gums. We see it in saliva. We see it in actual gingiva, the actual gingival tissue, we see it. And most importantly, we see it in serum, or, you know, serum is a part of the blood. You can kind of, for all intents and purposes, call it blood, but its serum is the part of the blood that doesn't clot. Okay, it doesn't have fibrinogen. Now, when serum levels of these patients, of IL-6 patients, let's say, they've been reported to be significantly higher for patients with gum disease, and it's usually in a healthy situation. You know, the value could range from 0.25 to 40. That's where it is actually. Sorry, that's what it's going to be in the range in periodontitis patients. So 0.25. Remember these numbers. We're going to come back to these numbers. 0.25 to 41 picograms per milliliter. And there's been reports in the study, periodontitis patients in their serum have up to 216 picograms per milliliter. Okay? Now, you're going to see in a moment, we're going to tie it in, because when you get above 80 is when people are getting on a ventilator. Okay? So we're going to talk about it in a moment, but I just want to give you a preview. So again, these are the literature that cites this. I mean, there's a lot of literature to show IL-6's role in periodontitis. So there is the following findings are basically why we see such a strong evidence. So genetic studies confirm IL-6 polymorphisms can be increased susceptibility to periodontitis. Genetic studies confirm that IL-6 polymorphisms can be, in vitro studies also confirm IL-6 can be produced by a variety of cells in periodontium, being a mediator for inflammation and a host response and bone destruction. We have, again, this is just a review of what we just talked about. We see it in periodontal tissues. We see it in the gingival crevicular fluid. We see it in saliva of potential of periodontitis patients. And we also, again, this is not studied as much, but they find IL-6, high IL-6 levels also in pulpitis and in periapical lesions. So that is why when people, that you're hearing this new holistic approach to dentistry, when they say, you know, when root canals go bad, when there's a, you know, the root canal has already a periapical lesion, you know, it may not be the best to try to retreat it. You know, it might be more predictable to go with an implant. You know, again, that's debatable. I'm not making a case for one or the other, but there's more and more research coming out now on pulpitis and periapical lesions, showing that there is a high IL-6 level. And a lot of other oral conditions contribute to systemic inflammation, and can lead to this increased cytokine storm. So let's talk about respiratory disease in particular and COVID. So COPD, or chronic obstructive pulmonary disease, is very prevalent. It's basically we see higher prevalence with COPD patients and in patients with periodontitis. So I don't want to get into too much detail, but just know people that have more COPD have more periodontitis. People that have pneumonia as well, they have there's a significant association with pneumonia and poor oral hygiene. With comprehensive dental care, they see a dramatic decrease on pneumonia. Isn't that interesting? And again, the take-home point here is in hospitalized patients, intense dental therapy can help prevent respiratory complications. So this is, and keep in mind, COVID is a respiratory disease. That's where the ACE receptors are. That it starts in the nose, goes deep in the nose, it goes down the throat, because these are where the ACE receptors are. And the virus can bind on these receptors, and then also down in the lungs. So it ends up in the lungs and our inability to breathe. So this also, there's a relationship, a significant association between periodontitis and lung function in general. And people who have a decreased lung function, airflow limitation, they have a tendency to have more missing teeth. With periodontal therapy, again, this has nothing, the three things I just mentioned have nothing to do with COVID. I'm just saying in general. But when you just clean people's teeth that have lung problems, they get improved lung function. Wow. Why is no one talking about this right now? So, and also asthma has been. But also asthma, some people, they use a lot of inhalers, they do mouth breathing, may have lower saliva, so there's some confounding factors that could be playing here. So this is not as strong as an association as the other ones. Sorry, this is the slide over here. So this is not as much as a factor as the other ones, because of the dry mouth possibly. So just a summary here, we have periodontitis, and we talked about COPD, lung function, pneumonia, helping and doing cleanings and plaque control can improve the lungs, the lung function, and when people are hospitalized, it improves. So right now, people are hospitalized due to poor lung function. Perhaps, if dentistry and medicine were a little bit more connected rather than separated, the doctors go to medical school, the dentists go to dental school. So, doctors don't check the gums, which is absurd to me. I still don't understand why medical doctors, they don't have a probe when they should. That's going to be probably one of my missions in life, is to be part of the solution to getting all doctors, the hospitals. How much does a probe cost? Not much. Put a probe, show them a quick video on how to measure, just stick it in, see if it bleeds, see how deep it goes, refer to the dentist. End of story. That will change healthcare, I believe. And I'm talking about just some of it, but heart health and lung. Those are two of the most common causes why people die. Heart and lungs. Your heart stops pumping, or there's a clot somewhere, or stop breathing. That's how most deaths, along with maybe cancer and car accidents, that's where the bulk of it is. So that could be improved. So now let's talk about IL-6 viral infections and COVID-19. So you can see, again, this goes back to right now we're seeing our mortality rates aren't as bad as we thought. We're seeing, as far as the deaths are closer to, 0.3% to 1% range. So it's not as bad, at least in the United States, with the deaths. But let's talk about now. So these are the ACE receptors that I talked about, and they're present in many cells and tissues, including they're in the lungs, they're in the heart, they're in blood vessels, kidneys, liver. So they're in a lot of parts of the body too. So they're not just in the lungs. You can see they're not just in the lungs. You can see that. So this is, I want to talk about this article. This is one of the most important articles you will have seen in 2020. More important than mine. Because this is what sparked my article. This is what got me moving. This is what motivated me. And I spoke with the author, Dr. Tobias Harold. He's from Germany. Now, basically, what he shows is that of the people, and this is a very simple study, very easy. The people in the hospital that came in, he took their drew their blood when they come into the hospital, and then draws their blood when they're in bad shape, when they can't breathe, or right before. So at different times, he says, him and his team, they say, let's see what's going on in the body. Let's see where all the levels are, all the immune function cells. Let's see what's going on. Let's see if we see any patterns or any trends. So he finds that there is a strong association between IL-6 and the need for being on a ventilator. And it was almost black and white, as you can see. See that dotted line that says 80? He noticed that when people's IL-6 went above 80, people went on a ventilator. It was almost every time. Now you see the two outlier dots in science, people disregard that. So it's almost like black and white, but we'll even leave those dots there and count them in. That is what we call in science, in the article, look at the word. The title of the article is Elevated Levels of IL-6 and CRP Predict. Not associated, not cause, not correlation. It's a predictor. And it's a 22 times higher chance. And I don't know if you guys, what your math level is, but 22 times means there's a over 2,000 higher chance of respiratory complications. And by respiratory complications, I mean a machine breathing for you.